My name is Brent Overton. I'm one of the spine surgeons here at the Steindler Orthopedic Clinic, and today I'm going to be talking to you about anterior cervical fusion in order to treat neck and arm pain. This pain is caused by pinched nerves that occur in the neck, and that can be either from a herniated disc or bone spurs or disc that have bulged out and are compressing a nerve. This causes intense pain going down your arm, but also may cause numbness and tingling. In order to treat this surgically, we have to take the pressure off of the nerves. The way we do that is by actually removing the disc and the bone spurs that's causing the pinching that occurs next to the nerves. The way this is performed, we actually make an incision in the front of the neck, up below the voice box and just off to the side. It's a small incision. Usually it's about 1 inch or maybe 1.5 inches. We go through the front of the neck because the disc is actually in the front of the spine. This area shows where the base of the skull is. This area shows the area of the neck that reaches the shoulders. Each bone is separated by different discs. So when we make our incision, we're actually going to travel between the trachea and esophagus and that vessel and nerve down to the front of the neck. It's there where we actually remove the disc and take it out through the front so that we're actually unpinching the nerves that lie in the back. If I turn the model around, you can see that there's some yellow nerves traveling between these bones, and then they branch out to the sides shown here. But we can't go in through the back because that's where the spinal cord lives. We go in through the front and remove the disc out the front away from the nerves, leaving a gap between these two bones. And this is why it's called an anterior cervical fusion. We're actually fusing the two bones together with a spacer in between. Looking at the model again, you can see that if we have a gap here, we can put a spacer in between the two, and that may be made of bone or it may be made of a high density plastic that the bone can go through, and then we place metal in front of it and hold it with a plate and screws. By doing that, these two bones will no longer move with one another. They'll actually be fused together into one bone, and therefore there's no disc that can go back out and repinch the nerves again.